I want to tell you what adopting this budget amendment actually means. It's more complicated than just saying, well, this just adopts the Hyde Amendment. Under Virginia law right now, Medicaid recipients can receive funding not through the Medicaid plan, but from the Department of Health for abortions in 3 circumstances: the life of the mother, rape or incest, or in the case of a gross fetal abnormality. There's some question that the way this is written, because those abortions are not covered by the Medicaid plan, but by the Department of Health, state funding won't be able to be used for any of them. But I want to focus in on the gross fetal abnormality. That means, I'm going to give you 2 quick examples, and in the interest of time, I'm not going to read what the mothers said. I'm just going to tell you what happened. I'm going to start with Christy Brooks, who in her 2nd trimester, she found out that her baby would suffer from congenital diaphragmatic hernia, a hole in her diaphragm that would cause her to suffocate upon birth. If she was a Medicaid patient and this amendment passed and she got that abortion to terminate that pregnancy, rather than have her child suffocate upon birth, she would have to pay for that out of pocket. Tracy from Arlington, who was a federal employee, so covered by the Hyde Amendment, 4 months after suffering a stillbirth, was ecstatic to learn she was pregnant again, but she was understandably anxious. So at 9.5 weeks, her ultrasound disclosed an enlarged nuchal translucency, and that the heart and intestines of her child were outside of its chest and stomach. The following week, she got a diagnosis of a condition called pentology of Cantrell, which is a midline defect resulting in an ectopic and deformed heart, a cleft chest, and some things that I can't pronounce, which sounded pretty scary to her. At 12 weeks, the ultrasound showed that the baby's spine was deformed as well. At 14.5 weeks, it was clear the spine was deformed and was pulling down the back of her brain, causing hydrocephalus and brain damage. The doctor didn't think that that baby was capable of moving its legs out of the fetal position. The lung tissue appeared deformed, and the doctor didn't think the lungs would function. At this point, the doctor told Tracy and her husband their options. They could wait until there was fetal demise. They could carry to term, have a C-section, and the minute the umbilical cord was cut, the baby would die due to lack of oxygen, or they could terminate the pregnancy. They got a second opinion. At the second opinion, it confirmed the diagnosis, but they got another gut punch. As federal employees, their insurance under the Hyde Amendment would not cover the procedure to terminate that pregnancy. She got another gut punch. The hospital would consider her uninsured and not admit her. So now, Tracy has to decide, am I going to pay for this out of pocket? And where am I going to go to get it? What this amendment will say is if you are a pregnant individual on Medicaid. So you're not going to be able to afford to come out of pocket. In some parts of the state where you're not going to be admitted to a hospital, there's not a clinic nearby. This amendment will say you are on your own. It should not be the case that when you have gotten devastating news, that on top of that, your choices about what to do will be dictated by the insurance that you have. That is what this amendment does. We usually do not pass this amendment. I think maybe in one year we did, but usually we don't. It's very rare that these cases happen. I think at most in the past year, there have been 22 instances total. Let's not insert ourselves into the decision of what these families will do in these devastating circumstances. I ask that we pass this amendment by.